no internet. Yep, there it is. There we go.
Has everyone joined the meeting? I will reconvene this board meeting and ask Ms. Kazi to lead us in the Pledge of Allegiance, please.
I would be honored.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Ms. Kazi. And thank you for everyone's patience as we were having a school report over at Madison number 1 up until just recently. We're moving on to communications and announcements. Dr. Baka.
Thank you, Madam President, members of the governing board and executive team. Please join me up front. We are here to recognize our Shining Star and You Make the Difference for Madison Park Middle School and Madison Camel View Elementary School. Ms. Anna Andrews, the president of our Madison District Classroom Teachers Association, will come forward and recognize the merits and accomplishments of our staff. So please join me. Andrews?
Can you, oh, okay, all right. The You Make the Difference and Shining Star Awards are presented by the Madison District Classroom Teachers Association and Madison Administration to recognize the certified and classified staff who truly demonstrate Madison's vision of inspiring passion for learning and leading in an ever-changing world. And our first recipient of the evening for the You Make the Difference Award is Ashley Anderson. Miss Anderson is both an amazing teacher and colleague. Despite the overwhelming amount of work that everyone has on their shoulders this year, Miss Anderson consistently finds ways to help her teammates and keep a positive attitude. She goes above and beyond to make sure that her students' needs are taken care of and cares deeply about the success of each and every one of them. Her positive attitude at work is contagious and inspires others to find the little joys in each and every day. Miss Anderson not only has a positive impact on her team, but the entire school. She works with all teachers and staff to assure the success of all students. Teammates can always go to Ashley for guidance or advice. She is the kind of colleague that would drop anything to help another colleague out, whether it be a question, needing a resource, or just a listening ear. Ashley is always there. The students love Miss Anderson. She does an amazing job of building relationships with each of her students. Her students know that she wants the best for them and is willing to do what it takes to get them there. Ashley has an excitement and passion for learning that her students can genuinely feel. It is an honor to have Miss Anderson as a teacher at Madison Park. She truly makes a difference.
Get ready because you're going to say a few words.
I did hear that. Do I do it here or over?
Wherever you're comfortable. Why don't you come up here?
Sure. I'd like to present you with your award. I'm going to leave it in the box so that I just wanted to say thank you. I mean, gosh, that almost brought me to tears. It's easy to make a difference and be an exceptional teacher for exceptional leadership. Thank you to Becky and Maggie. They are kind of the backbone of the entire school, and my team is amazing. So easy to do. I'm very honored though. Thank you.
Oh, yes, yeah. Do you have anyone here with you?
My parents are actually here.
Where are
They
they?
were excited to come.
Would you please, if they wave,
Where are
pick
they?
them out because
Oh, sure. That's
Hi.
my mom taking pictures. And Chad, my dad, Joe.
Hi, Mom. Hi, Dad.
And this is Maggie, our principal. I know you're here, but
You did a great job.
All right, our next You Make the Difference recipient is Danielle King. We are pleased to announce that Danielle King has been nominated for the You Make a Difference Award at Camel View for the first semester. Danielle has been a Camel View Cub for the past 6 years, teaching 3rd grade, and most recently, she is serving as our math and reading interventionist. It is hard to put into words what Danielle brings to the Camel View campus, but some of the thoughts that come to mind are hardworking, dedicated, and passionate about what is best for kids. Danielle is an absolute wealth of knowledge and expert when it comes to instructional strategies and supporting struggling students. She is a leader on campus, and our teachers consistently reach out to her for ideas to help support their students. Danielle facilitates professional development for our staff, has served as a team leader, and has been the point person for our Move On When Reading program for the past 4 years. Danielle has also been an active member of the Student Success Team. In addition to Danielle's skills as a teacher leader on our campus, something else that stands out is her integrity and core values. Danielle models kindness to everyone on campus and leads with her heart. She is patient and demonstrates empathy for our students. She is positive and solution-focused and has a tremendous positive impact on our school culture. Madison Camel View is so lucky to have an amazing teacher like Danielle King. Danielle, you 100% are making a difference at Madison Camel View. Thank you for all that you do.
Come on up this way. I want to give you your award and thank you for all of your service to all of your students and your colleagues at Camel View. And now we get to make you take a photo. Want to say anything?
I'm just super honored. I love my school, I love my students, and I believe in their soul actions. It's an honor.
We are all the lucky ones.
I appreciate it so much.
And who's joining us tonight with you?
Have anyone that you would like to introduce?
Your principal?
Hello.
This is my best friend, Amanda.
She used to teach for us.
yes, I do. It's so nice to see you guys.
So I'm just thankful.
Wait, did you get the picture? Did you get a picture?
You got the
Yeah,
picture?
Yeah.
okay.
Thank you.
Thank you so much.
Thank you.
All right, our first Shining Star Award recipient is John Carlson. It is with great pride and sincere appreciation to have the opportunity to recognize John Carlson for the Shining Star Award at Madison Park School. As our night lead, John always strives to be professional, diligent, and dedicated each and every day throughout our campus. John is committed to ensuring our campus is maintained and is a strong contributor to making it a clean, safe, and healthy learning environment. He collaboratively works with his team to maintain our campus and ensure that it is conducive to our school-wide focus to support the needs and success of all students. John not only maintains the Madison Park campus, but also the Madison Traditional Academy Preschool and Madison Highland Prep High School. He works with our leadership from all 3 sites to ensure all 3 campuses are operational. John and his team make it a priority to quickly and efficiently complete requests and/or work orders from all 3 school sites. You will always find John to be kind, friendly, and outgoing. He is always willing to go the extra mile to serve others. John Carlson is truly a shining star at Madison Park.
We'd like to present you with this and say thank you for your service. And do you have any words that you'd like to share?
I'm just one of the people on the team where it's not just me, it's everybody that I work with, our staff, everybody. So, but I appreciate it. I feel honored. Thank you very much.
Oh, you don't get to
When you
run
get your
away.
picture.
Thank you.
Thank you so much.
Do you have anybody with you? No? Yeah, well, yeah, Becky.
So he has his Park family here.
Yeah, part of family, yeah.
All right, and our second Shining Star recipient is Christine Zamora. Christine Zamora, or Nurse Christine, as our students lovingly call her, is a shining star for many, many reasons. Nurse Christine plays an integral role in ensuring that the staff and students at Madison Camelview are well cared for. During the school day, Nurse Christine is seen mending injured knees, assisting students with the flu, checking immunization records, assisting parents with medical support outside of school, and all that is in between. These past 2 years have not been easy on any of our health associates, but Nurse Christine seems to do it with ease. She is able to effectively take care of children's needs while also ensuring we are tracking COVID cases across our campus. Nurse Christine is a wealth of knowledge when it comes to COVID-19 and is able to navigate quarantines with ease. Christine has kept all necessary personnel in the know with whom is quarantining and for how long. These helpful forms of communique have helped ease this burden on our campus. Nurse Christine not only helps our students, but has been known to support staff with minor alignments as well with her advice and expertise. Nurse Christine is truly a pivotal member of our Madison Camelview family. Not a day goes by that we do not cherish all that she does. Thank you, Christine Zamora, for being a shining star at Madison Camelview.
Thank you so much.
Introduce your family.
It's our honor to present you with this token of our appreciation and your colleagues' recognition. Have anything you would like to share?
Well, thank you. I've been here for a while. My job is my pride and joy, working with the children and stuff. They make me happy for injuries and help them through their sickness. So that's my part of my job, and working, making sure they're healthy and our staff. So I enjoy that very, very much. So thank you all very, very much.
Thank you. And who do you have
Who do
here
you have with you?
My husband, my son, and my son.
Oh, hi. Three generations. Hopefully we'll see a picture.
Got it, don't worry, it won't break. And if it does, we'll replace it.
Thank you very much.
Yeah.
And to our honorees, you're welcome to stay. However, we know that you may have other commitments, so thank you for being here tonight. Those are the presentations and recognitions.
Thank you so much, Dr. Baka. And now we are moving on to 5.2 Superintendent's Report.
Thank you. Madam President, member of the Governing Board and Executive Team, this Thursday, the Strategic Plan Design Team will meet to continue its work on the district's continuous learning framework. Ahead of this meeting, I just wish to thank all those who are serving on the design team for their time, commitment, passion, and very much their valuable ideas and work, so thank you to them. Yesterday, the Maricopa County Superior Court judge ruled that a key provision of the state's budget bill were unconstitutional. Part of those provisions included the prohibition of districts requiring masks for students and staff, the prohibition of teachers, administrators, and other school officials for making certain curriculum and instructional choices, and striking down the prohibition of a public official from using public monies or public resources to organize, plan, or execute any activity that impedes or prevents a public school from operating for any period of time. It is uncertain how the state will respond, but there is the probability of an appeal and the possibility of an executive order being issued. Regarding face coverings, as was announced last week, if the court had ruled that school districts can implement face covering mandates, that Madison will continue its current face requirement that we have in place. At this time, we have just over 94% of students wearing face coverings. If you recall, we closed the opt-out option within 1 week of when it was offered. Several families in the meantime have revoked their initial opt-out, as the Maricopa County Department of Public Health quarantine guidelines reduce the likelihood of students needing to quarantine if they are masked. I recognize this will not eliminate students wearing masks from needing to quarantine, but it has reduced significantly the number of students who need to quarantine. Currently, the percent of active cases as of 2:30 today, the percent of active cases throughout the district is at 0.25% of the total student population. Since the first day of school, and including the current active cases, the total number of cases throughout the district for students stands at 2.4% per student population. Unfortunately, I have to clarify something that is going on in social media that needs to be cleared so that it does not create a life of its own. Regarding our dashboard, there is chatter on social media that we are hiding cases. There is also false, inaccurate, and offensive wording that is used about how we handle the reporting of cases. The spreading of this lie makes the work of staff unbearable at times. So allow me to clarify. Cases posted on our dashboard are based on reports to the district. We work closely with the Maricopa County Department of Public Health to track these cases. The cases on our dashboard are cases reported while the student was on site within 5 days or less of contracting COVID. If a student tests positive for COVID but was not on site for the past 5 days or more, the cases are not reported on the dashboard since no individual at the school or site would have been exposed. Again, this is per guidelines from the Maricopa County Department of Public Health. This can happen when a parent keeps a child home from school because a household member, more than likely, or another contact, has tested positive. If that student doesn't initially test positive, but does after 5 days or more, then the parent reports their child has tested positive. Per Maricopa County Department of Public Health, we do not report that case on our dashboard, nor send notification, since no one at the school would have been exposed. We are not being shady. We are not misleading our public. We are not lying. We are following the Maricopa County Department of Public Health guidelines of how cases are tracked and reported. So I ask that misinformation be corrected, and if anyone wishes to contact the Maricopa County Department of Public Health regarding the guidelines, which for information, we have a staff member that on a weekly basis attends their weekly briefing on how to do things, how to manage it, contact tracing and the like. They're welcome to do that as well. The district has also ordered air purifiers for every classroom. So unless there are shipping delays, we expect to have the units before or soon after we return from fall break. I joked with Ms. Garvey that maybe we should rent a U-Haul truck to go down to California and pick them up if there are shipping delays, but I think we're going to skip that part. And I really do wish to thank our PTOs for assisting with purchasing of the purifiers. We could not have done the purchasing for every single classroom without their help and assistance. So together we can ensure every classroom at every school has this vital mitigation tool. And I also wish to thank our parents and families for sharing and advocating throughout this process for their perspective on several other COVID-related issues. And then finally, Friday, believe it or not, is the last day of the first quarter. And so next week is fall break, and I wish everyone a safe and joyous break. That concludes my report.
Thank you, Dr. Baka. We are now moving on to governing board member reports. I will start on my left this time. Mr. Holcomb?
Thank you. I want to echo Dr. Baka's comments about thanking the community, that getting the air purifiers and working with the district and the PTOs shows the level of support and understanding of people in the community. That's a phenomenal partnership between the district and the community. And I also want to emphasize something that we've talked about quite a bit. Not only has Madison gone above and beyond in doing its dashboard and reporting, but it's constantly been given accolades for the way it's approached its mitigation, particularly contact tracing, so that we can keep as many students in class as possible and cut back on the quarantining. So, Dr. Baka, I very much appreciate the fact that you are correcting the misinformation. We need to deal with the facts. We need to deal with data and not misinformation. And it's unfortunate that there's those out there that feel that they need to do that. On a lighter note, I did want to let people know, we are trying to get things as back to normal as possible, and that continues to happen at the Madison. I went to both of the concerts that ASU Symphony brought to the Madison, and there's more coming. The first night, there were about 300 people there, which is about what they get when they have concerts at Gamage. The second one had over 500 people there from all over the valley. So that has been a great success, and hopefully is something our community will take advantage of and continue, to move back towards something more closer to normal. And again, we just had the reports from our elementary schools. I could not be more proud of our staff, our teachers, everyone, our administrators at the schools. They are doing phenomenal work under very trying conditions. And so whatever people in the community can do to help, give them support, understand, and as Dr. Baka has said so many times, and I've really learned to appreciate this word, give them the grace that they need. That will help them, it will help your children, it will help all of our families. Thank you.
Thank you, Mr. Holcomb. Ms. Gresham?
Thank you. Yes, I'm also happy about the air purifiers. That's really good news for our students and our teachers as well. Can you hear me? Is this on? Okay. Yeah, I want to congratulate all our award winners tonight. It's nice to be doing that again. And also thank you to our principals for the reports for our elementary schools. I know a lot of work goes into those. And also going along with what Mr. Holcomb said, they are the front lines. The principals and our teachers, they're the front lines, for our parents and our students. So they just really need to be treated with respect, and they deserve every ounce of our respect. So I just encourage everyone to again have grace and treat them with the respect that they deserve. And also I believe our bus driver appreciation day is tomorrow. So I will be out at the bus stop embarrassing my children and giving our bus driver some appreciation, some gifts. So I just want to remind everyone about that. Thank you.
Thank you, Ms. Gresham. Dr. Osborne?
Nothing to report.
Thank you. Ms. Causey?
Thank you, Madam Chair. I'd just like to acknowledge the fact that we had our first PTO, not really like luncheon, it was kind of a meeting and then a takeaway luncheon for the first time, and I think it was close to 18, 19 months. It was a significant amount of time. And I'm sorry? A year ago. Well, it's actually a little bit more, I think. Yeah. Yeah. And so that was, I think, we had great attendance, great feedback. Want to thank the PTOs and the individual families that have contributed to funds that allowed some schools to purchase air purifiers on their own, which resulted in us being able to then purchase air purifiers for every classroom. Incredibly generous and incredibly impactful. I'd also like to just ask and reiterate some points made by Dr. Baka and my colleagues. appeal to people's better angels. I would ask that everyone in our community, be you a parent or a taxpayer or just a concerned citizen, that when you interact with our staff, you treat them with civility, and more critically, before we put things on social media, please check your facts, because we know that once information is out there, unfortunately, there is a perception that if it's on social media, it must be true. And I think we all know that we need to be responsible for the actions we take on that front. Thank you.
Thank you, Ms. Kazi. I also want to echo my colleagues' sentiments with regards to how some of the members of our community are conducting themselves. I want to thank first the parents and community members who conduct themselves with grace and empathy, as this is the Madison way. While tensions may be high and the tenor of our political discourse may not be quite the Madison way right now, at no time is it ever acceptable to take frustrations out on any member of the Madison staff, bus drivers, custodians, teachers, school principals, crossing guards. No one should ever have to put up with unkind words or anything extending beyond that. If we want our students to stay in classrooms and be taught by teachers that have been here for a long time, we need to make sure that we are treating them with the respect that they have earned. I don't have anything else to report. There are a number of calls to the public. As is customary, I will call your name to the podium. You have 3 minutes. First, I call Rachel Deathridge. Dr. Rachel Deathridge. My apologies.
Oh, that's okay. Rachel Deathridge is fine. Can you guys hear me?
Yes, a little closer, and please speak up.
Can this push in? Okay, I will speak up better.
Yes, thank you.
Okay. Thank you. Thank you again for allowing me to speak. So hello, Madison Governing Board and Dr. Baka. And I want to thank you again for your time and your efforts, and thank you so much for getting these air purifiers into the classrooms. And that was actually a very big concern of mine anyway, especially for our Title I schools that maybe don't have the funds for that. As of 2 weeks ago at SIMUS, thanks to our PTA and to our parents, we actually have all of our classrooms K through 12 with air purifiers in them to have at least 4 to 5 air exchanges per hour, which is great news. So I'm really happy to hear that you've helped the other schools and that they'll have those soon. So as you said, Ms. Kazi, that we're a year and a half into this pandemic, and unfortunately, it's not better, right? Things haven't necessarily changed in terms of the virus, but we're doing better as a community. And so I really hope that now that we can still realize and look at the data, as you also said, Mr. Holcomb, that we're following the data, that we're still in high transmission. We're still in high transmission in our county and in our elementary district, and it's still necessary for us to have masking. And with these new layered mitigation approaches with HEPA filtration, I'm very hopeful for that. Children, you know, they have the most life to live of all of us, and so it makes it necessary for us to do everything that we can to protect them from the acute and the chronic aspects of this virus. Many of us, and you hear in the community and in the media and everything, that children do fine. And thank God the majority of them do. Thank goodness, right? But there are those hidden aspects and real aspects of kids in the hospital that I'm sure that you also hear about. There is an article in The Lancet that was published in July 2021 for the global minimum estimates of children affected by COVID-19 associated orphanhood. In that article, the U.S. has a rate of 1.5 per 1,000 children who have the death of a primary caregiver. That's sobering, right? Our community is not immune from this. This is the U.S. Children in general who lose primary caregivers have higher risks of experiencing mental health problems, physical, emotional, even sexual abuse, and family poverty. I know that our schools do a great job at really trying to help children in every way that they can, with food, with social support, with all of that. And so this should also be in our minds when we are looking at improving care for our kids here and for our students and for keeping them in class and for keeping them in masks. And so I really want to make sure that that point comes home. There's never going to be 100% agreement of the public at large on any matter, not just COVID mitigation matters. And that's why we have expert decision makers in our nation. And at this point, it's the CDC and our Maricopa Department of Health. And so I hope that we can continue and follow more closely the CDC guidelines to recommend universal indoor masking for all students, staff members, adults, and visitors to our schools. And thank you so much.
Thank you. Thank you. Next, I'm going to call Yarden Tohan. Dr. Yarden Tohan.
That's okay.
Thank you.
Hi, guys. Hi again. Thank you for everything you guys have been doing. I want to talk to you guys today again about masking. I know that the ruling came in yesterday and we are able to have real universal masking like we did last year. And Dr. Baka mentioned that over 96% of our families are following this and did not opt out, which means that over 96% of our families want to send their kids to safe schools and want to take the steps that are needed to protect others. Unfortunately, that still leaves a little less than 4% who are kind of holding everyone else hostage by not choosing to protect others. You can look at, you mentioned, Facebook and social media. You can look at our Meadows Facebook page right now and see how angry some parents are that their kids worked really hard to go to a color party this week, but they got seated next to a sixth grader who was unmasked and had COVID. And because their kid was wearing a mask, but the one who had COVID wasn't, they can't go to their color party this week. They did everything they were supposed to do. So even if they're healthy and they don't get anyone sick, they're still missing out and they're still missing school. And so I spoke with someone this week who I really respect, and they gave me a good analogy. They said when someone in their family had cancer, they went to an expert, and the expert in that case was an oncologist. So what I want to ask you guys tonight is, don't just listen to me, don't just listen to Dr. Deathridge, who's awesome, or anyone else who came here to spend their time. Listen to the experts. So you have local experts like the Arizona Department of Health, the Arizona Department of Education. You have national experts like the Center for Disease Control and Prevention. You have international experts like the World Health Organization. You have medical experts like the American Society for Infectious Diseases, the American Academy of Pediatrics. All of these people employ full-time epidemiologists, physicians, experts, and all of them, without exception, including every other medical, health, scientific society, all of them are saying universal masking with very few exceptions, not parent opt-outs. Very, very few exceptions. And so I guess I just have to ask us, if we're not listening to the experts, who are we listening to? Whose advice are we taking on this? And what does that teach our kids who are following all the rules? Thanks.
Thank you.
And just a correction, it's 94%.
94, sorry.
Yes, that's okay. Just wanted to make sure we have it was corrected.
Thank you, Dr. Baka. Next, I will call Satoko Koyama.
Hi, my name is Dr. Koyama. I am a pediatric emergency medicine physician and a parent of an MTA student. Thank you so much for taking the time to listen to me today, Superintendent and all the board. Thank you. Sorry, I don't know everyone's names yet. But thanks for having me. So I'm here to give you kind of, I'm a frontline worker. I work in the pediatric ER. I see kids. And what I see is long haul symptoms, 15%. There's a study that came out that showed that 15% of kids do get long haul symptoms. I had a child who every time he ate, it smelled like death. Rancid, he couldn't taste anything. He had lost 15 pounds. He had acquired COVID in March, and I saw him in about July of this year. And he had already gone to multiple ERs in our community, gotten fluids because he was dehydrated, gotten the anti-nausea medicine, and the only thing I could say to his mom was, I'm really sorry. I have no idea what I can do for you. There are ENTs that are trying to figure this out, neurologists that are trying to help these patients. It's not common, but it is something that happens, and it broke my heart to look at this kid who can't eat anymore. And he has so many years, right? I've had 47 years of eating delicious food in my life, and this poor kid, no more. Who knows when his taste will come back. I see patients whose parents have passed away. I had to take care of a child whose mom passed away, coded in my ER while I was seeing him. His dad died of COVID the week prior. I had to call social work. I had to find, folks who can figure out who's going to take him home after I admitted him, because he too was having COVID symptoms. So, I hear the stories that, oh, my kid had COVID, or I had COVID, or my family had COVID, and we all did fine. Thank goodness, right? Thank God that you're okay. But if you're that one person, this is going to affect you for the rest of your life. I see a lot of kids right now with depression, mental health issues. Staying home had been really stressful last year in homeschooling. I saw this wonderful presentation at the beginning of this. It warms my heart that everyone is here to take care of our kids and keep them in school. And I hope that we can keep them in school. And that is a universal mask mandate with only exceptions, with medical exceptions. Kids who have autism who can't keep their masks on. Let's protect these kids who can't keep their masks on. So I implore you all, please have a mask mandate that requires everyone to wear a mask unless they have a medical exception. Thank you.
Thank you. Dr. Baka, since this is not an agendized item, I'm going to go ahead and ask you to the calls to the public and report back on information that you're able to identify.
Yes, sure. And Madam President, I will do what I always do, which is consult with those who are at the sites, teachers, classified staff, or site administrators, consult with each of you individually to let you know what I have as I study this matter.
Thank you very much, Dr. Baka. We're moving on to the consent agenda. I will accept a motion to approve the consent agenda.
So moved.
Is there a second? Moved by Ms. Causey, seconded by Mr. Holcomb. Please vote accordingly. That motion passes unanimously. Moving on to information items, in this case, one item. 8.1, Superintendent Search Update. Dr. Baka, would you please introduce this item?
Sure, Madam President, members of the Governing Board and Executive Team. As you know, we are utilizing the services of Ray & Associates to conduct the superintendent search. And we, when I say we, the team that is meeting with them is the board president, Ms. Spear, along with me and Ms. Barb Marshall, our Assistant Superintendent for Educational Services, and Ms. Nicole Rodriguez, our Director for Communities Relations and Marketing. And we met on September 16th to finalize the details of the timeline that was established by you as a board. Thank you all. The board interviews, I think they've contacted each of you. Those have been completed. As a reminder, the survey link for the feedback is due back at 8 a.m. on October 5th. I want to compliment Ms. Causey for being the first. I told Ray & Associates that I know the rest of you are taking your time and completing that survey because you're like Ms. Causey, being very thoughtful and deliberate with your surveys. As far as the community survey, we have 690 that have been completed thus far. 6 of those have been in Spanish, so we're glad that we had those translated for our families who speak Spanish. That's 54 classified staff. We have 8 students who have actually completed a survey, 22 administrators, 105 teacher and certified support staff, 3 community stakeholders, and 498 parents and families. So we want to remind and encourage everyone you have until October 5th to go ahead and complete that survey. That data will be presented to you as a board on October 12th, along with what they gleaned from the board interviews, so that you can approve the advertisement flyer that will be going out. And then finally, the stakeholder focus groups have been identified and invited to participate actually tomorrow. All focus group data, again, will be shared with the board. as additional data to support the superintendent search processes. At this time, we have those who have confirmed, including 8 of our 7th and 8th grade students that will be participating with that tomorrow. As a reminder, the other groups are classified staff administrators, teachers, certified staff, community members who are not parents and or families, and then our Madison parents and family representatives. I don't know, Ms. Spear, if you want to add anything to that.
I don't have anything else to add, except that a week from today is the deadline to submit the survey. So every member of our community that received a link for that survey, please make sure that you fill that out. That is critical information that Ray and Associates will use to help inform us of what the wishes of our stakeholders are in terms of the qualities that we're looking for in our next superintendent. So I urge everyone to please do fill that out. This is your opportunity to have your opinions and your voice heard.
And just one other thing, Ms. Marshall has been working on the in-basket activities. We're narrowing it down, understanding that where it goes and when it's given and given to the finalists, that will matter in terms of the interview questions you may ask. We want to balance that with anything that may be asked with that in-basket as well.
Perfect. Thank you.
I don't know if there are any questions.
Are there any other questions? Any questions from board members? Okay. We will continue to report as we meet on the processes as we move forward. Moving on to board policies, second read. Dr. Baka, could you please introduce this item?
Thank you, Madam President. Members of the governing board and executive team will take each of separately. You've had the opportunity to have it as a first read at our previous board meeting, and I'm checking to see, after reviewing board policy EEAEA, if there are any other questions or suggestions for edits.
Are there any questions from board members?
So then we seek your approval.
I will accept a motion to approve board policy EEAEA, bus driver requirements, training and responsibilities.
Madam President, since we have this, unless there's some objection, can we vote on them as all together as one item?
Madam President, Mr. Holcomb, members of the governing board and executive team, I ask that we vote on them individually. There are 2 policies that there were some corrections, thanks to Ms. Gresham catching some errors that I would like to point out.
Thank you. I appreciate that. I move to adopt the first board policy.
I'll second the motion.
Thank you. Moved by Mr. Holcomb, seconded by Ms. Causey. Please vote. And for those of you who may be watching, it's not that we are pondering our votes. The system takes a minute to load for us to go ahead and register our vote. That motion passes unanimously. Moving on to 9.2, Dr. Baka.
Thank you, Madam President. Board policy ECGB has went through the first review and first read, I should say, and is now here for the second read, and we ask for your approval.
I will accept a motion to approve 9.2 as presented.
Madam Chair, I move that we approve board policy GCB as.
Thank you. Is there a second?
I'll second.
Thank you. Moved by Ms. Causey, seconded by Ms. Gresham. Please vote. That motion passes unanimously. Moving on to 9.3, Dr. Baka.
Thank you, Madam President, members of the governing board and executive team. I'm going to call your attention to page 2 of this revised policy, specifically bullet number 3. We had failed to put the year after July 1st to clarify that it was 2021. Otherwise, it would have read it was July 1st, and June 30th, 2022. So thank you for Ms. Gresham for catching that, and it's been corrected. With that, we ask for your approval.
Thank you. I will accept a motion to approve 9.3 as presented.
So moved.
Thank you. Moved by Ms. Gresham. Is there a second?
Second.
Thank you. Moved by Ms. Gresham, seconded by Mr. Holcomb. Please vote. And thank you to Ms. Gresham for catching that.
You're welcome.
That motion passes unanimously. Moving on to 9.4, Dr. Baka.
Thank you, Madam President, members of the governing board and executive team. I want to applaud Ms. Humphrey for keeping up. I call your attention to page 3 of this policy, specifically the last paragraph. We rectified it. The 1 business day from the date was in our original policy. ASBA, when they were proposing changes, had wanted a new or suggested that districts could put in their number of days. We already had it in there. So we hadn't removed it and kept ours as is, and now it reflects what we currently do. And so we ask for your approval.
Thank you. I will accept a motion to approve 9.4 as presented by Dr. Baka.
Madam Chair, I move that we approve Board Policy GCF as presented.
Thank you. Is there a second?
I'll second.
Moved by Ms. Causey, seconded by Ms. Gresham. Please vote. That motion passes. Moving on to 9.5, Dr. Baka.
Thank you, Madam President, members of the Governing Board and Executive Team for 9.5, 9.6, and 9.7. I just ask that you approve those individually since you have to do electronically. There are no other changes or additions unless the board desires to do so.
Thank you. I will accept a motion to approve 9.5 as presented.
So moved.
Thank you. Is there a second? Okay, moved by Ms. Gresham, seconded by Dr. Osborne. Please vote. Thank you. That motion passes unanimously. Moving on to 9.6, Dr. Baka.
Ask that you approve.
Yep.
So moved.
Yes, okay. I'm going to, yes. Thank you for the motion to approve.
Second.
9.6, Mr. Holcomb, Ms. Causey, first and second, please vote. That motion passes unanimously. I will also accept a motion to approve 9.7.
So moved.
Thank you, Dr. Osborne. Is there a second?
I will second that motion.
Thank you, Ms. Gresham. Moved by Dr. Osborne, seconded by Ms. Gresham. Please vote.
Everybody got to play in that one.
I know, this is, yes. Everybody gets a turn. Thank you. That motion passes unanimously. Moving on to 10.1, discussion regarding future meetings. Dr. Baka.
Thank you, Madam President, members of the Governing Board and Executive Team. On October 12th, we will continue our study session for our school integrated action plan reports with our middle schools starting at 4 o'clock in the Madison No. 1 school library. Reconvening here for a regular meeting at 6. Ms. Causey will present information regarding the delegate assembly update. I also want to call your attention to the action item beyond just the annual financial report that Ms. Garvey will bring. Ray and Associates will also be presenting their information and reports on what was gleaned from the focus groups and surveys that went into what they will be recommending for their search flyer as well as the application. So you will be taking action on that. On October 26th, we'll have the You Make the Difference Shining Star from MTA in Madison Rose Lane. We're waiting to see whether or not we will have a showcase. We want to be very mindful of the spread of COVID and want to mitigate that by not having too many people congregate together. So it's slated for October 26th, but we may push that off. And then that's when we'll give you an update on the superintendent search and the bond and override expenditure report. And then just moving forward through the unscheduled meetings that we had on the calendar, we called for special board meetings and executive sessions for the superintendent search as well as for interviews. I just want you to know that the calendar here reflects all of those special meetings.
Thank you very much. Are there any questions, comments, suggestions from my colleagues? Mr. Holcomb.
Yeah, just a request. Can you send us out the calendar so we can get all those dates on our calendar, or those calendar invites already been sent out?
if they have not already, and I think they have, Ms. Humphrey will make sure to follow through
All
with
of
you.
these,
So-
okay.
They
Now
have
I
all- yeah.
recognize them, yeah, okay.
They've all been calendarized, actually. We have all got meeting makers in our inbox. And thank you to Ms. Humphreys for keeping us up to date on our own calendars. We very much appreciate it. With that, I will accept a motion to adjourn.
So moved.
Thank you, Dr. Osborne. Is there a second?
Second.
Thank you. Moved by Dr. Osborne to adjourn, seconded by Ms. Gresham. Please vote. Again, we're not pondering whether to adjourn. It's just a little delay. That motion passes unanimously. We are adjourned.